In a normal standard IVF, there are 4 different types of hormones that we are going to use. All these hormones can either be produced as a recombinant hormone, so that means that there are culture of cells that produce an hormone that is biologically identical to the ones that the woman's produce, or sometimes these hormones can be obtained from biological products, either the urine of menopausal woman or the placenta. Okay, these tissues are processed, and we obtain these hormones that are used later for stimulating the ovaries. These are basically the hormones that are used for stimulating and inducing the ovarian and triggering the ovulation. The other types of drugs that are also used are the GnRH agonist and GnRH antagonist. These are the drugs that are used to block the natural ovulation. When we do a normal IVF, we want the patient not to ovulate until we think she's ready for the egg collection, so we can get a good number of mature eggs. Therefore, for a few days, patients may have to take 2 different injections at the same time. One injection is going to keep stimulating the ovaries, the other injection is going to block the natural ovulations. These are drugs that are synthetical, artificial, and they are focused on preventing the patient from ovulating. And then there is a 4th type of drug, which is the progesterone, that is usually started after the egg collection. The progesterones that we now work with are natural micronized progesterones, or are progesterones that are exactly the same as the natural progesterone produced by the ovaries. And in this sense, they have no risk, and the progesterone is useful because it's going to prepare the endometrium to allow the implantation of the embryo. So to sum up, we have 4 different types of hormones that are going to stimulate the ovaries: recombinant FSH, recombinant HMA, LH, or biological HMG. We are going to use drugs to block the ovulation, GnRH agonist or antagonist. We are going to use drugs to trigger the ovulation, HCG, usually recombinant, HCG, and also the progesterone to prepare the endometrium, which is natural micronized progesterone, as I've said, to prepare the endometrium for the embryo implantation.